Bringing back the house call. Their doctors, nurse practitioners, and physician assistants care for people with multiple chronic health conditions and take the hassle out of going to the hospital. They come to you. Joining us now is Landmark Nurse Practitioner Randy Herbert. Randy, thanks so much for joining us on Great Day.
Thank you.
Of course. So for those of us who, we have a general idea of what Landmark does, but can you kind of delve in a little bit deeper for us? You guys are like coaches, best friends, family members, right?
Right. So Landmark is a local medical group. We specialize in managing chronic conditions and urgent care visits through house calls. Our patients are people with multiple chronic medical conditions. We feel like today's healthcare system can be difficult to navigate, and
Definitely.
So we're there. We can get into the home and really see a patient's needs and situation, treat them in place, and manage their care amongst all their providers.
So this at least doesn't eliminate entirely, but definitely takes down on how often you're going to the hospital, right?
We are trying to do some preventative medicine, yes. So we're trying to catch things early so that it doesn't progress to the point where they do end up in an emergency room.
Sure. Okay. So tell us a little bit about your experience. Why did you make the transition to Landmark?
I actually used to work in the emergency room, and I could understand the value of seeing a patient in their home where they're more comfortable, relaxed, and open to discussion. We have longer appointment times, and in the comfort of their home, we can really get to the root cause of things to help prevent that illness from progressing to where they might end up in the emergency room.
Sure. So you guys are like the best friends, the family members, as I said earlier. I mean, you really get to know these people and their chronic conditions and really help them, right?
Right, so we're in the home with the patients, their families present throughout the visit. We're in the comfort of their own home. Right,
okay. So how does this takes away the stress, I would assume, from not only the patient but the family members as well. Is that accurate?
It can. Some of our patients, when they are ill, it's difficult for them to get in to see their primary doctor. It takes a lot out of them. So now they can stay in their home and we'll come to them to treat them in their home.
Okay. And so everybody's different. So, I mean, you kind of go through a whole medical history and background with the patients too.
We do. We really get to know their medical history, some of their health care goals. We want to know what they would like to achieve with their health care, and we work with them and come up with a plan for them to achieve that.
Okay. And I know you have several examples of patients who really say that Landmark has really helped them, right?
I do. One of my patients that I'm thinking of, he has multiple chronic lung issues, and he lives on oxygen, and when he gets sick, it is difficult for him to get to see his doctor.
Sure.
Well, now he can give me a call, and I'll come out and see him. He called me one day and felt like he was coming down with another pneumonia, and I wasn't going to be able to see him that day, but the next morning. Well, in the meantime, we have portable x-ray capabilities that we sent out to the house, got an x-ray, diagnosed him with pneumonia, got him started on all his medicines that evening. By the time I saw him the next day, he was already feeling better. So it wasn't progressing and getting worse.
Sure. So, I mean, you're just a phone call away, it sounds like. You're available 24/7 for these patients.
24/7, all year long, weekends, holidays. Somebody's always going to be there to give you some advice or come out and see you.
That's wonderful. Okay. And how does that feel, just knowing that you're helping people?
It's great. I used to work in the emergency room, and seeing people sick is not fun. They are not at their best, and we're working to prevent them from going to the emergency room.
Definitely. Okay, and your Landmark is expanding, so you're hiring for several positions. Can you tell me about some of those positions?
We're looking for doctors, nurse practitioners, nurses, behavioral health providers, social workers. We have a whole comprehensive team approach to treat the whole patient. So if I'm ever in somebody's home and I sense they're having a little depression, we have behavioral health providers that can get in there quickly so that you're not waiting potentially weeks for a referral and appointment with an outside provider.
That makes sense. And again, just your patients.
We do. We get in there several times a year. We really get to know them and their families.
Okay. So tell me, which areas do you cover?
Right now we have the Mississippi Gulf Coast. We have all of the North Shore and expanding into Metairie and New Orleans. So we need some more people.
So Landmark's taken over. assuming you have enough people and enough jobs to fill, right?
Well, we're not going to replace any primary care providers.
Right,
we're
right,
working in conjunction with them.
Sure.
But we are that second line of defense, and we want to be there to help out the patients when they need us.
Sure. Okay, so anything else you wanted to add for us today? Anything you'd like potential patients to know, or?
Give us a call. We're always available. We're going to help you out the best way we can. We want to keep you healthy in your home.
Sure. Okay. Wonderful. Thank you so much.
Thank you.
All right. Well, to learn more about Landmark Health, you can visit them online at landmarkhealth.org. And of course, there's much more to come on Great Day after the break, so stick with us. We'll be back.